Hello. I'm here today to talk about the opioid epidemic. But before we get started on that, let me paint a picture for you that happens in any small town in America at the end of a nice cul-de-sac on a Friday afternoon as three children walk up to the driveway of another kid's house. One of them walks outside shaking his head. "Sorry, I'm not helping you guys today. We're going to have to go to the methadone clinic." Now, how do they get themselves going from just hanging out on a Friday afternoon to going to the methadone clinic? Well, several months ago, one of the child's mom has been hit with an illness and was prescribed powerful prescription pain medication, which one of the boys was sneaking out of the medicine cabinet and eventually selling to his friends. And what went from a casual weekend buzz turned into a bi-weekly buzz, into a daily buzz, into skipping out of school to get a buzz, to we need our buzz every day. Addiction. Addiction to an opioid. Now, when they can't get the opioid from the medicine cabinet that mom has so locked away for them, they're going to have to go down to the methadone clinic where most of the time a drug dealer will be waiting around the corner to sell them a heavier dose of a narcotic, perhaps heroin. Now, why do we want to talk about the opioid epidemic? Because people are going to do drugs whether we can help it or not. But according to the Douglas Berheim and Antonio Rangel Swedish Economic Policy Review published in 2005 titled "From Neuroscience to Public Policy and New Economic View of Addiction," it is estimated that 91 to 170 people die every day from an opioid overdose. And in 2015, more than 33,000 lives were lost to opioids. Another analysis from the Blue Cross and Blue Shield states that Blue Cross and Blue Shield of its members found that 2010 to 2016, the number of people diagnosed with the addiction of opioids, both legal prescriptions as well as illicit drugs, climbed nearly 500%. And so, with our death toll mounting, and it happening in our suburbs, and with perhaps our friends and our friends' children, this is something we all need to really wake up and talk about. And why do I have credibility to talk about that? Well, I've been in a relationship with someone for close to 10 years who has battled with an addiction. She's overcome that in that time, but spent 15 years in and out of institutions, incarcerated, in the hospital, at a different clinic, seeing a different doctor, trying to find a way out of the cycle of drug, cop, over and over again. So, after being in a relationship for a long time and seeing the effects of the recovery methods, I do think that there's a way out of this. And before we get started into the depth of this, we're going to talk about what I'm going to cover. I'm going to talk about how we can do that, which is going to be fighting fire with fire. And I'll get to that in a minute. I'm also going to talk about how our administration has not helped us by creating two different national security funds. We'll get to that. And also how our government has been involved for too long serving to big pharmaceutical companies and not to our public, letting the people and the states decide on how they can tackle this crisis. Let me get first started to talk what I mean about fire with fire. When I say that, generally that's not how we're going to solve any of our problems. What I mean is we're going to use opioids to fight opioids. We've known how morphine is addictive and heroin is addictive. But then the pharmaceutical companies have created a synthetic opioid called Suboxone. This is something that can be prescribed as a doctor and is a sublingual form of drug, which means you can place it under your tongue and it is dissolved. Many of the participants of addiction are addicted to the physical contact that you get from using a hypodermic needle. It's less about the drug and more about the use of a needle, but that's another argument another time. So using fire to fight fire, opioids with opioids, is going to be our way out of that. I've watched several people come complete full circle, from full-blown addict to almost death, come completely out of that and have a new rejuvenation on life of sobriety. So now let's talk about the difference between the national security, how Mr. Donald Trump has played a part of this. Now, according to my audience analysis, everybody is split down the party lines, whether or not they're Republican or Democrat. But in a majority unanimous, nobody knew the difference of what the Public Health Emergency Fund and the National Health Emergency is. Well, the Public Health Emergency Fund contains $50,000 due to the immense underfunding it has received by Congress in the past years. That has been determined by Laura Nichols in the Clinical Guidelines for the Use of Buprenorphine in the Treatment of Opioid Addiction Treatment Improvement Protocol of the U.S. Department of Health and Human Services. In contrast, $78.5 billion is the estimate put forth in a study of the future costs for the opioid epidemic, whereas the declaration of the national emergency would have qualified the crisis as to something much less. When you've only got $57,000 to hand out to your organizations to take care of its people, that's nothing compared to $78 billion. And Mr. Donald Trump, I don't think really understands how big of a crisis this really is. And so we want to talk about how long our government has actually been involved with this. With the invention of the hypodermic needle back in the late 1800s, the pharmaceutical companies were using heroin in its daily cough suppressants. But in 1909, Congress passed the first act passed the Opioid Exclusion Act, barring the importation of opiates. And in 1914, Congress passed the Narcotics Act, and in 1924, the Anti-Heroin Act of 1924. So our government has been on its side, but that's on a federal level. Now, as we've seen with perhaps the marijuana industry, you see how the states take control, and now everybody's happy. They've got more money coming in their way, they've got more people on their side getting it done. And so, let me restate all of these. We're going to need more opiates to fight our opiate problem. We need to understand the difference between what a public health crisis and a national health emergency are. And we need to take less control from our federal government and put it back into the states. I hope this has been, let me restate my thesis here. The opiate crisis is a serious issue in which the Trump administration is incorrectly handling. Some solutions for rectifying this ongoing problem include using new discovery of opiates for the solution and declaring our opiate crisis a national emergency and not a public health crisis. I hope this information has been in service to you, and I hope we can all do our best to inform our congresspeople and our local officials about how we need to take the control into the state's hands, educate our lawmakers so that we can have less deaths and end this epidemic. Thank you guys for your time tonight. I'm going to show them.
Yeah, everybody stand back up. Hello, hello. One more, Anna. There's one. Perfect.
Did you get all one?
The dog's on me.
We got them all.
Good night.